All right, this is Dr. Story. I'm going to give you some realistic information, stuff that you can use. I'm going to title it Gonstead Nuggets of Information that I've gathered over the years of being in practice. I've been in practice for 24 years and we see tons of patients with all different types of problems, but I'm going to summarize for you 3 specific low back problems that require 3 separate different types of treatments. And if you're treating one of them and the person has the other, you're totally missing the mark. So, number 1, sacroiliac joint problems. Now, most commonly, a patient with sacroiliac joint problems will have trouble when they're walking. That's the clue. So if a person says, when I sit down, I feel okay, but when I walk, I get lots of pain, then you have to look at the sacroiliac joints. Now, there are some physical therapists that came up with 7 famous ways to diagnose sacroiliac joint dysfunction, and I would say that's overkill. I use the standing Gelay test, which has worked for me for decades. It works awesome, and it also tells you whether to adjust the pelvis or the actual sacrum. Now, you could look at x-ray too, but this is a golden nugget. So I do the standing Gelay test, and one of the things that you will also notice is the person will have pain in the sacroiliac joint when they bend backwards. So the exercises, once the person is adjusted well, the exercises that you want to give them are fast-paced walking, and I'll put a link down below on how to do that walking. The second type of problem is a disc problem. Now, I know in Gonstead we're supposed to be thinking that everything is the disc, but quite frankly, that's ridiculous. Sometimes it's other problems, but most commonly you'll see with disc problems that the patient will have pain bending forward. So either they will, if you ask them to do a standing lumbopelvic flexion and they try to touch their toes and they get to about 30 degrees and they're just like, that's it, I'm not going any farther. That's usually a disc problem. Also, there's another name for disc problems called flexion intolerant lower back pain, and that's become more popular in the last 5-10 years. So what that means is a person will sit down, initially they'll feel good, and then they'll start hurting with sitting, and then by standing and walking around, their pain improves. So if a person bends forward, can't go past 30 degrees, if the person sits down for a long period of time and gets pain, normally you're talking about a disc problem. The best exercise for that, besides getting adjusted, the best exercise is McKenzie exercises. And I'll put a link for you down below of how to do those exercises for another video. The last problem, the third problem, and this is very common, is called facet syndrome. And facet syndrome is diagnosed by, usually you'll hear the patient in their history, they'll say, when I walk, I feel okay. When I stand, I actually get pain, but when I sit, I feel better. So this is a person who very likely has facet syndrome. The way you examine it is usually you'll have the patient bend backwards and rotate to the right or rotate to the left, and that'll tell you which side the person has the facet problem on. Now, the best thing you could do is to adjust these people a little bit into flexion as well as rotate away from that facet, and that gives them almost sometimes immediate relief. The best exercise for a facet problem is to do a deep squat, and I'll have a video down below in the description. And I hope this helps people with back pain, and if you're a Gonstead chiropractor, hopefully this gives you some insight in the history and the exam to know where the person's problem is.